So hello everyone, we are going to look upon the ulnar nerve. So the basics of the ulnar nerve. The origin of the ulnar nerve is from the what is the medial cord of the brachial plexus. So the origin of this ulnar nerve, which we are able to see, is nothing but medial cord of the brachial plexus. So its root value will be C7, C8, and T1. I'll repeat: the root value of this ulnar nerve is C7, is C8, and T1. So after this root value and origin, we are going to look upon the course of the ulnar nerve. So as we can see here, this is our brachial artery. So the marking point of ulnar nerve is nothing but it is medial to the brachial artery. This is brachial artery. It should be medial. It should be medial to the brachial artery. So it goes medial to the brachial artery. It comes behind the medial epicondyle. So we can see, I'll palpate here. See, this is the medial epicondyle. So this ulnar nerve is nothing but it will run medial to the brachial artery and it goes behind the medial epicondyle, and after going behind the medial epicondyle it comes front. It goes between the two heads of the muscle which is present here, which is nothing but our flexor carpi ulnaris. Flexor, which will flex the arm. Flexor carpi, it runs towards the carpi and it is on the ulnar side. So the ulnar artery, after going behind the medial epicondyle, it comes front and it goes between. I'm telling, it goes between the two heads of flexor carpi ulnaris. After going in between the flexor carpi ulnaris, it comes on the anterior aspect. There are two muscles here which are deep, the flexor digitorum superficialis and flexor digitorum profundus. So this ulnar artery goes in between the flexor digitorum superficialis and flexor digitorum profundus. So it goes between. It comes here, and it comes here. And after running between the FDP and FDS, it comes up and it is superficial to the flexor retinaculum. Superficial to the flexor retinaculum. That is very important point here. It is superficial to flexor retinaculum. And here we can see it's after near the wrist joint, it gives two branches. It gives two branches. One is superficial branch and one is our deep branch. Near the wrist we can see here we have ulnar artery also. So the marking point near the wrist is ulnar artery. This ulnar nerve is medial to the ulnar artery. That we have to keep in mind. Ulnar nerve is medial to the ulnar artery. So it gives two branches, superficial one and deep branch. See, here we can see there is one superficial branch and there is one, this is deep branch. So both the branches supply different muscles. So the superficial branch supplies one of the superficial muscle which we are able to see here. This muscle, this is nothing but our palmaris brevis muscle. So the superficial part of the ulnar nerve will supply this palmaris brevis muscle. So only one muscle is supplied by palmaris superficial branch of ulnar nerve. So what are the muscles supplied by the deep branch of the ulnar nerve? So those are all interosseous muscles. Let it be palmar interossea or let it be dorsal interossea. All interosseous muscles will be supplied by our deep branch of ulnar nerve. Along with it, there is hypothenar muscles, digiti minimi, flexor digiti minimi muscles and all. Those are also supplied, we call it as hypothenar muscles. Those are also supplied by our deep branch of ulnar nerve. With this, so we have covered the deep branch, like the muscles which are supplied are nothing but our hypothenar muscles, all interosseous muscle, let it be palmar interossea or dorsal interossea. Along with that, the deep branch is also supplying some of the pollicis muscle. That is nothing but our here, which we can see here, nothing but our adductor pollicis, and there is flexor pollicis brevis. That is also supplied by our deep branch of ulnar nerve. So this and the one point which we have to talk about here is ulnar nerve supplies hand muscles most of the. It is not seen in supplying of our forearm and arm. Ulnar nerve supplies most of the hand part. Thank you.